thanks so much for joining us for today's presentation, Copay or Premium Financial Assistance in Less Than 5 Minutes, presented by the Healthwell Foundation. I'm Carla, the Director of User Engagement at NeedyMeds, and before we get started, I'd like to offer some tips so you can make the most out of today's presentation. First of all, if you do have questions during the presentation, you can go ahead and type them into the question section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If I don't get a chance to answer your question, if we don't get a chance to answer your questions, we will follow up with you via email. But of course, we will provide the contact information for ourselves, NeedyMeds, and the Healthwell Foundation at the end. This webinar is being recorded and will be posted on the NeedyMeds YouTube channel, which I hope you subscribe to. And you can find our PowerPoint slide decks as well as other materials we thought you'd be interested in that handout section of your control panel. So let's get started with what is NeedyMeds. For those of you not familiar with us, NeedyMeds is a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Richard Sagal, and his friend, Libby Overly, who is a medical social worker. Rich is still the NeedyMeds president. What you're looking at on your screen now is the NeedyMeds mission statement, a statement about how we achieve that mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. What you're looking at now is a screenshot of our homepage, and I like to put that up because our website really is the face of our organization, and it also gives me an opportunity to point out a few things, such as if you're looking for healthcare cost savings programs, you will begin your search with the Healthcare Savings tab. Next to that, the Education tab is where you will find our educational information. This is where you can sign up for webinars, our monthly newsletter, and order brochures, for example. I mentioned that today's webinar is being recorded and will be available on the NeedyMeds YouTube channel, and you can find a link to that on the top right with the rest of our social media icons. And you can also check out and register for future webinars on the calendar of events on the bottom right-hand side. So as you saw a couple of slides ago, a big part of our mission is education. And we define education in 2 ways, by educating people about NeedyMeds and the healthcare savings resources we offer. But we also educate people about our partners that offer other healthcare savings resources and expert tips, which is why we are so pleased to have my friend and colleague, Jeremy Abundy from the Healthwell Foundation, here with us today. I'll introduce Jeremy, our guest, in a moment, but first, let me tell you just a little bit about the Healthwell Foundation. They are a leading nonprofit dedicated to improving access to care for America's underinsured. Their mission is to reduce financial barriers to care for underinsured patients with chronic or life-altering diseases. Basically, when health insurance is not enough, they fill the gap by assisting with copays, premiums, deductibles, and out-of-pocket expenses. And our guest, Jeremy, is going to walk us through how they do that. Jeremy is the manager of provider and pharmacy relations and joined at the Healthwell Foundation, which he joined in August of 2020. Jeremy serves as a liaison to physicians' offices, and pharmacies to ensure familiarity with their programs and processes. And he's responsible for coming up with the most efficient methods to increase stakeholder engagement on behalf of the patients they serve. Bringing over 16 years' experience in healthcare patient assistance, patient advocacy, and program administration to the foundation, he most recently served as Director of Corporate Social Responsibility, Government Affairs, and Public Policy for Mallinckrodt Pharmaceuticals. Jeremy has a master's in healthcare administration from the University of Maryland, University College, and a BS in kinesiology from the University of Maryland at College Park. And forgive me, Jeremy, I'm pretty sure I pronounced the name of the organization where you're a director incorrectly. So feel free to correct me right now. But I'll give Jeremy a chance to do that. And most importantly, I will now pass the mic and the screen to Jeremy so he can begin his presentation. Thanks so much, everybody, for taking time out of your day to join us. And with that, and without further ado, I'm going to go ahead and pass the screen to Jeremy. And a reminder, as Jeremy is grabbing that screen, if you do have questions, you can go ahead and submit them by typing them into the questions section of your GoToWebinar control panel. Thanks, everybody. And Jeremy, I'll pass the mic to you.
Great. Thank you so much, Carla, for that wonderful introduction. And you actually nailed it. It's Mallinckrodt Pharmaceuticals, which is a mouthful for sure, but you had it perfectly. So thank you for that.
Fantastic. I was just looking for you to point out how well I did there. So thank you. Excellent. So there you go. Thanks, everybody. Enjoy the presentation.
Thanks, Carla. And hello, everyone. Thank you so much for joining me today. I'm so excited to have this opportunity to speak with you, not only about the Healthwell Foundation, but how you can apply for copay or premium assistance in less than 5 minutes. Our system is designed to make it really quick and easy for you to submit your applications. And I hope when we complete this presentation today, you have a good sense of what it takes to apply and a good feeling on how to move forward with those application process. So as Carla said, I'm Jeremy Abundy, Manager of Provider and Pharmacy Relations at Healthwell Foundation. And we're going to cover a lot of information in this webinar today. If you have any questions after this webinar and want to reach out to me, please feel free to do so. My contact information will be provided in the slide deck, and I welcome any questions you may have, so please do feel free to reach out to me. Before we begin, I just wanted to get a quick level set of the topics we plan to cover today. First and foremost, for those that aren't familiar, I'll provide a quick overview of charitable patient assistance programs, or CPAPs as they're commonly referred to. Then I'm going to introduce the Healthwell Foundation and give you a brief overview of our programs and services. And then we'll get into the meat and potatoes of the presentation. We're going to walk through the online application process step by step. Again, the application process is super quick and easy, and we'll give you all the tools you need to apply in just a matter of minutes. Once we've completed the application process and walked you through that, we'll talk a little bit about our patient portal. I'm going to highlight the registration process for the portal, teach you how to register to use the portal, and then highlight some exciting functions that we're pleased to provide to you. And then at the end, there'll be time for questions. I'm happy to answer those for you. So let's begin. Patient Assistance Program, what is that? Patient assistance is a broad term that encompasses both patient clinical education support and financial support. And financial support can really be broken down for uninsured patients into 3 segments. First, there's manufacturer sponsored copay support. Those are your copay cards and coupons that you may have applied to a manufacturer for. There's foundation support through charitable patient assistance programs, or CPAPs. And that's to address patient need when there's financial hardship and or coverage of medical expenses for the underinsured. So basically, if you have insurance, but insurance isn't covering all of your medication, foundations such as Healthwell Foundation may be able to assist. And finally, the third segment of financial support is free drug program, typically provided for patients either without insurance or with insurance that doesn't provide coverage for a specific drug. So let's take a bit of a deeper dive into foundation support, or CPAPs. CPAP provides financial assistance to patients with insurance. So you may be asking, well, how is that different from a manufacturer copay support program? And there's a number of differences. CPAP programs provide assistance that is not product specific. Eligibility requirements must include income limits and verification requirements. Assistance covers branded generic, and generic products that fall under specific disease funds. Assistance is provided via a grant from the foundation, and Medicare beneficiaries are eligible to receive assistance. So as you can see on the screen, there are a number of foundations that make up the quote-unquote CPAP community. For your reference, we provided the names of those organizations, their websites, and contact phone numbers. And I think it's important to highlight that collectively, this community of foundations provide an estimated $1.6 billion collectively in financial support each year. So now that you're familiar with charitable patient assistance programs, we want to take just a few minutes to provide a brief overview of the Healthwell Foundation and the work that we do here. Healthwell Foundation is an independent 501c3 national organization based here in Germantown, Maryland. We were established in 2003 to improve patient access to life-changing medical treatments. And since we launched our first fund in 2004, we've offered assistance across 80 different disease funds, and I'll highlight that for you in just a minute. We were the first foundation of only two to have written OIG opinion to operate funds openly only to Medicare beneficiaries. And currently, about 88% of our grantees are Medicare patients. 100% of donated dollars at Healthwell Foundation go directly to patients and services. And as of December of 2020, nearly 160,000 active patient grants were in our system. Since our inception, Healthwell has paid a total of over $2.1 billion to more than 615,000 patients via more than 930,000 grants. And I alluded to the different disease funds, 80 in total, that we've provided assistance for since our inception in 2004. Here's the list. I'm not going to go through one by one, but it does paint a broad picture of all of the different areas and disease states that we do assist with. So now that you're familiar with patient assistance and the work that we do here at Healthwell Foundation, I want to spend the remaining time we have together discussing the grant process and how to submit an online application. So before you apply, before you ever log onto the system, there's some information that you're going to want to gather in order to make that application process run more smoothly. We'll need your age, and if the patient is under the age of 18, we'll need parent and or guardian information as well. Patient's legal name and address, phone number, insurance information, social security number, household size, and annual household income. So once you've got that information, you may be eager to apply and wondering, how do I qualify? So there's three key areas that you must meet in order to qualify for assistance. First and foremost, you have to have some form of health insurance, either major medical insurance or prescription drug coverage. You have to have an income that is less than 400% or 500% of the federal poverty level, and that's going to vary depending on which disease fund you're applying to. And you must be receiving treatment for a specific medical condition for which funding is available. So again, the fund that you're applying for must be open in order for you to qualify for assistance. So you have all your information. You're confident that you will qualify for a grant and wondering how to apply. So there's two main ways to apply. You can either go to our website, healthwellfoundation.org, or you can call us at 800-675-8416. For today's purposes, we're going to walk through the online application process. And it's important to know that if approved, you'll receive instant notification of that approval. The approval letter will be mailed to your house as the patient. And for any pharmacists or providers that may be in attendance today, I also want to highlight the fact that you have the ability to apply on your patient's behalf, not through the online application via our website, but through the respective provider and pharmacy portals. And once you've done that, you have the ability to log in and download approval letters for your patients as well. So let's begin the online application process. To begin the application process, you'll want to go to our website, healthwellfoundation.org. And the first thing you'll want to do is check our medications list to ensure that the product that you're taking is covered under the fund that you're wishing to apply for. To do so, click on the blue disease funds button that you see in the center of your screen and select the disease fund that you wish to apply for. When you click on that disease fund that you wish to apply for, you'll be taken to a specific fund detail page. In this case, for our example, it's our hepatitis C fund page. And you'll see a lot of information there, specifically the status of the fund, whether it's open or closed, the fund type, which may be copay and or premium assistance, maximum award level, which in this case for hepatitis C is $30,000, pharmacy card fund, whether or not a pharmacy card is associated with this type of grant, household income limit, in this case it's 500% of federal poverty level, and most importantly, treatments covered. Those are the list of medications that are covered by this particular fund. And this is where you want to verify that the drug you are on and being prescribed is covered under that fund. Once you verify that your medication is covered by the fund that you want to apply for, scroll down to the bottom of that same screen and review the fund definition. Once you've done that and you're ready to apply, click on the Apply Now button. This will bring you to the online application instructions page, and you'll want to take a few minutes to review Healthwell's online application instructions. There's two key things that you're going to want to pay particular attention to. First, if you are privately insured, that means you do not have Medicare or Medicaid, and you have not already contacted the manufacturer of the medication that you're requesting assistance for, we ask that you please do so. Many manufacturers offer assistance for their products, and we do require that you do that and reach out prior to applying for our program. The other thing to keep in mind is please only submit one application. Submitting multiple applications will not expedite a decision on your behalf and may in fact slow the process. So please, one application. Once you reviewed those instructions, click the Continue button. And next, you'll want to click the button to indicate that you are the patient and at least 18 years old, and then click the Continue button. All right, so let's see if you qualify. First thing you'll want to do is select the fund that you're hoping to apply for. Once you've done that, click the Continue button. And this will bring you to the medication list for that specific fund. You must be taking a qualifying medication in order to be eligible, and you want to select all the medications within that fund that you are currently taking. Once you've done that, click the button to indicate whether or not you have insurance for the requested therapy, and then click the Continue button. Next, we're going to ask what type of assistance you're requesting. There are actually two types, either copay assistance or premium assistance. If you select copay assistance, you're asking Healthwell to assist with the amount you pay after your insurance company has paid for the qualifying medications. On the contrary, if you select premium assistance, you're asking Healthwell to assist with the amount you pay to your insurance company to have medical or prescription coverage. Once you've made your selection, click the Continue button. And again, we reference manufacturer programs. If you are privately insured, that is, do not have Medicare or Medicaid, we ask that you contact the manufacturer to inquire about possible assistance through their company. Once you've read through that, indicate whether or not you have Medicare and whether or not you have contacted the manufacturer, and click the Continue button. This brings you to our patient attestation page. Please take a minute to review this. The purpose of this attestation is to confirm that the information that you are providing is true and accurate to the best of your knowledge. Check the box to indicate that you have read, fully understand, and agree to the patient attestation. Once you've checked the box, please click the Continue button. Income verification. Now take a moment to read through the income verification attestation. Please note that by agreeing to the income verification, you are authorizing Healthwell to have a third-party service consult your credit profile and other information in order to verify your income. To proceed with the application, click the I agree button and then the Continue button. And please note, if you do select I do not agree, this will result in the cancellation of your application. So we'll click Continue. And now you want to fill in the remainder of the insurance verification information. To do so, indicate which state you currently live in from the drop-down menu. Fill in the number in your household, number of people living in your household, and finally enter your annual household income and click the Continue button. Next is patient information. We'll collect information from you, including your name, phone number, and mailing address. You'll want to complete all required fields and then click the Continue button. Provider information. From time to time, we do need to reach out to your provider in order to manage your grant, and it's extremely helpful if we have your prescribing provider's information, name, contact phone number on file. Please enter your provider's name and contact phone number and click the Continue button. Insurance information. You'll now want to enter your primary insurance. This is required, and if you happen to have secondary or tertiary insurance, please provide that information as well, and then click Continue to proceed. Alternate contact. You can choose to provide consent for Healthwell to discuss information about your grant with someone else. If you would like to do that, choose the Yes button and enter your alternate contact's first and last name, phone number, and relationship to you. Click Continue to proceed. All right, almost there. Final review. Take a few minutes to review your applications. You want to make sure everything that you've entered is correct. If it's not, if you find any errors, you can edit anything you've entered at this point. And if everything is correct, please click the submit button. Congratulations, you successfully submitted your online application. It's just that easy. And if approved, we offer a number of things. You'll instantly have access to your pharmacy card information, and you'll see on the screen there's a sample pharmacy card with patient's name, member ID, and all the information they will need to process a claim. We also offer direct billing with providers and pharmacies, and the ability to reapply after 12 months. So that was a lot, but it really is just that quick. You successfully submitted an application and are ready to log in to begin your own personal applications. Now that you're ready to do that, I'm going to spend a couple of minutes highlighting how to register for our patient portal, and more importantly, highlighting some key new functionality that we think will be very beneficial to you as you navigate the application process. So once you've submitted your application, you can then register to use the portal. Once you've registered for the patient portal, you'll have access to your Healthwell ID number. You'll be able to upload outstanding documents, view your grant status, check your grant balance and payment status, and sign up to receive real-time fund alerts. And I'll tell you about that functionality in just a few minutes. To get started, what you'll want to do is click on the yellow portals button located at the top of the screen, and then select patient portal from the drop-down menu. From then you'll land on this patient portal screen. Scroll down to the red patient portal button and click on it. And since this is your first time logging into the patient portal, you'll actually need to create an account. So you'll see at the bottom of the page a red create an account button. Click on that. Here you'll fill in your Healthwell ID, which is located on the approval letter that you'll receive in the mail, along with your birth date, the last 4 digits of your social security number, and your email address. Once you've entered all of that information, please click on the red create your account button. You're going to receive a auto-generated system email, which will enable you to establish your password for the portal. Once you've established your password, you can then come back to this page, log in using the email that you provided and the password that you created, and then click on the log in your account button. Success, you've logged in. Here we are on the main portal page for patients. And again, there are a number of things that you can access, including Healthwell ID, check the grant status. But one new feature that we're really excited about is the ability to upload documents. So you'll see here on the screen in the application process, if you need to upload documents, you can simply go to this page, click on the patient tab at the top left of the screen, and then click on the red upload document button. This will give you a drop down to select what type of document you're uploading. Choose from the drop down, and then select a file to upload and click the upload document button. After clicking that upload document button, you can simply navigate to the documents tab at the top center of the page. And there you'll see the document that you just uploaded, including the status of the review, the case number, and the date that you uploaded the document. And while you're on that document screen, if you've previously uploaded any documents, all of that information is here for you to review as well. As you can see there, this particular patient has 2 different documents that have been uploaded to their record. Another useful feature of the patient portal is the ability to view the status and date and balance of your grants. And to do that, you simply want to go to the grants tab again at the top of the page. And from there, you can view the status of the grant, the end date of the grant enrollment, and the balance on that grant. And if you need your pharmacy card information, you can simply click on the name of the grant. In this case, it's Cushing's disease. And that will take you to a page that displays your pharmacy card information. And you can see the sample card information there on the screen for you. Another really useful feature of the portal is the ability to review payments. Similar to the grants page, if you click on the payments tab, it'll display any funds that you're enrolled in, any payments that have been made, and the service date and the amount of the payment that was made. And this is where we get really exciting. This is a really fun feature that we think is really going to be useful to folks. It's the real-time fund alerts. And what it does is allow you to sign up for fund alerts via email when a particular fund opens or closes. To do that, you simply go to the Funds tab at the top of your page. You'll see it there on the right-hand side, and then click on the specific fund that you're interested in. In this case, it's acute myeloid leukemia. Click on that fund name, and you'll see the detailed information about that fund. At the bottom corner, you'll see a subscribe to alerts fund. Click on that, and it'll allow you to receive fund alert emails. Again, if the fund opens and or closes, if there's a change in the status, you'll be alerted via email. And we look forward in the coming year to also offer SMS text alerts, which we'll be rolling out at a later date. So you'll also be able to get text messages when a fund opens or closes. And one of the key features and the really exciting parts of the real-time fund alerts is that it is mobile friendly. Our website is a mobile friendly website, so you can use your mobile devices to log on to the portal and actually see the statuses of these grant funds to know whether or not a fund is open or closed, which really puts it at your fingertips and allows you to be more involved in the enrollment and process as funds become open and or closed. So that's a lot of information I've covered in a short period. I realize that. So like I said earlier, if there's questions about what was covered today in today's webinar, please feel free to reach out to me directly. My name and contact information is listed there for you. And if by chance you have an existing application or grant, you're going to want to contact our operations department at grants@healthwellfoundation.org for any specific questions related to an existing grant. They are the best people to be able to assist you with that. And with that, I think we have time left for questions. I'll turn it back over to Carla.
Fantastic. Thank you so much, Jeremy, for that very thorough explanation of the Healthwell Foundation. This is why we really like when our partners from the Healthwell Foundation come and share their knowledge with the NeedyMeds audience, and because that gives you guys the chance to see why NeedyMeds is so proud of our partnership with the Healthwell Foundation. It's not only that it's impressive the scope of support they provide, but the thought they put into getting the support, making getting that support easy. And I'm most impressed with the new addition of the Fund Alert. I think that's going to be super helpful to the Healthwell Foundation users. We are going to get to questions that are already coming in. And again, if you do have questions, you can type them into that question section of your GoToWebinar control panel. A reminder, if we don't get the chance to answer your question, of course, we will follow up with you via email, but I will put our contact information again on the last slide. Before we get to those questions, I want to remind everybody that NeedyMeds is also here as a source of support if you are having trouble affording your healthcare expenses. What you're looking at on the screen is all of the healthcare savings resources you can find under that healthcare savings tab on NeedyMeds.org. You can learn more about these by checking them out on that healthcare savings tab, by calling our call center, and again, I'll give the number at the end of the presentation, or even if you have time, joining us for one of our upcoming overview webinars. As I mentioned in the beginning, you can sign up for those webinars and see when they're coming up on the calendar of events on the NeedyMeds homepage on the bottom right-hand side. So as promised, I want to leave up the contact information to the Healthwell Foundation. You'll also see Jeremy's contact information as well as mine and NeedyMeds at the bottom of the screen. And I'm going to go ahead and leave this up as we get to those questions coming in, and it looks like there are a bunch coming in for Jeremy. I will remind everybody, check out that questions section in your GoToWebinar control panel, because we've uploaded not only our PowerPoint presentations, but also other materials we thought you'd be interested in. So we're going to go ahead and get to the questions coming in. And Jeremy, the first one, and I'm just doing a quick screen of these questions, and I'm thinking that these are ones you get pretty regularly. So the first one, for example, is, if I am approved for a grant, how long will my enrollment remain active? That's a good question and an important one.
Great question, and we do in fact get that question all the time. Enrollment is always for 12 months from the date of enrollment. So If you're enrolled, in February, you'll be enrolled through February of the following year.
Thank you so much. And that's what I really like about the Healthwell Foundation, that they have clear, concise guidelines that are really easy to understand. Another question coming in, and again, I think this is one you probably get all the time, which is, do funds ever close? And if so, why?
Yes, and we do get that question a lot. In fact, all of our funds are funded by donations. So that is a finite pool. So unfortunately, depending on demand within the fund, we do have to close funds from time to time based on those limited donated dollars.
That makes sense. So here's a follow-up question that was coming in as you were answering that one. So if I'm enrolled in a fund that closes, how does that affect my grant? Another important question.
That's a great question. And the short answer is it doesn't. Once you're enrolled in the program, like I said, enrollment is for 12 months. If we have to close that fund, it will not impact your grant whatsoever. Our director of operations likes to use the analogy of an airplane ride. If you think of an airline and they sell a certain number of tickets for a flight to a certain destination, you can kind of use that analogy to describe our programs. Once you've been awarded a grant and approved for a grant, you sort of have that ticket, and your ticket is good for that entire year. We will simply stop issuing tickets, if you will, and will not enroll any other patients into the program, but that does not impact your grant specifically. You will still have that enrollment for the entire 12-month period.
Thank you, Jeremy. And I like that analogy. It does make sense. And that clear answer, no doubt, will give people that are enrolled in grants a huge peace of mind, really important. Here's a pretty specific one, but I'm going to go ahead and ask it because I always feel like if one person in the audience is thinking of a question, the chances are other people are. So this question is, I was recently diagnosed with Hep C. Do you have a fund that may be able to assist me?
Great question, and I'm happy to say the answer is yes. We absolutely do have a hepatitis C fund, which is currently open, I'm happy to say. That fund is a copay fund and has a maximum award level of $30,000 annually. Household income limit for that fund is 500% of federal poverty level, and you can find all of this information on our website. And if you have specific questions or want to discuss anything further with me regarding our Hep C fund, please feel free to reach out to me directly. I'm happy to answer those questions for you.
Thank you so much, and thank you to our audience for these questions. Since we had a question about a specific assistance for a diagnosis, I will remind everybody that you can find assistance for your diagnosis-related care on the NeedyMeds website easily by visiting that healthcare savings tab that I keep talking about. In the center section, you will find our diagnosis-based assistance programs. So check those out. And there are other ways to be connected to diagnosis-related programs under that healthcare savings in addition to the diagnosis-based assistance programs. You'll be able to find diagnosis assistance through our coupons and rebates section, more information through our diagnosis information pages. So check that out. So here's the thing. We really do try and keep the questions portion of our webinars brief. So I'm going to go ahead and wrap it up with those few questions. But again, if you did ask a question that we didn't get the chance to answer, we will follow up with you via email, but don't hesitate to reach out to either the Healthwell Foundation or NeedyMeds sooner if you need an answer immediately. So with that, I, of course, want to thank my friend and colleague, Jeremy, from the Healthwell Foundation for taking time out of his busy schedule to share the Healthwell Foundation resources with the NeedyMeds audience. And I also want to thank our audience for taking time out of their days to join us. We do hope you stay in touch with both the Healthwell Foundation and NeedyMeds. And again, reach out to either Jeremy or myself with any questions about the webinar or the Healthwell Foundation and NeedyMeds with any of your general questions. Thanks, everybody, and we hope to see your name pop up in future webinars. Have a great rest of the day. Thank you.